Welcome to the Benefits Overview session. This video will provide an overview of the benefits available to benefit-eligible employees at the University of Illinois. If you have questions about the content of this presentation, contact UPB. The contact information for UPB can be found on the Benefits Overview Resources page. Here are some helpful links. The System Human Resources webpage is extremely useful for answering your questions. Personal information, such as your address or profile, can be updated on the MyUI info page. Information about benefits can be found on the Benefits webpage. We have also included a link to the Benefits Overview Resources page that contains all the resources and web pages mentioned in this presentation. Please note that the information found in this overview is effective as of July 1, 2024. The hours for UPB or University Payroll and Benefits are the same across all three universities. We have walk-in hours from 9 a.m. to 3 p.m. on Wednesday and Thursday, and our phones are on from 9 a.m. to 4 p.m. Monday through Friday. If you wish to make a request for service or ask questions by email, you can submit a ticket through the UPB service portal. Our UIC address is University Payroll and Benefits, UPB, 809 South Marchfield Avenue, First floor, mail code 547. Chicago, Illinois 60612-4305. The phone number is 312-996-7200. The fax number is 217-244-3135. Our office at UIS has a separate mailing and physical address. The mailing address is University Payroll and Benefits, UPB, Business Services Building, BSB. Room 85, 1 University Plaza, Springfield, Illinois 62703-5407. To visit the office, use the physical address or GPS address, 2420 Theodore Dreiser Lane. The contact phone number is 217-206-7144 and the fax number is 217-244-3135. The address for the Illinois office is University Payroll and Benefits, UPB, Henry Administration Building, 506 South Wright Street, Room 177, Mail Code 318. Urbana, Illinois 61801-3627. The phone number is 217-265-6363 and the fax number is 217-244-3135. These sessions are designed to provide a comprehensive set of benefit materials and information to assist newly benefit-eligible employees. If you need to register for another session, need to leave early today, or just want to hear the information again, you can do so on the course registration webpage found on the Benefits Overview Resources page. In this section, we will discuss the State University's retirement system, SURS. All benefit-eligible employees will participate in the State University's retirement system, or SURS. Their office is located in Champaign and their number is 800-275-7877 or 800-ASK-SURS, and their website can be found on the Benefits Overview Resources page. Employees are required to participate in SURS if their work is continuous for at least one academic term or 4 months, whichever is less, and their employment is not temporary, intermittent, or irregular. Employees who are newly hired, rehired, or are transferring to a substantially different position must be in a position that requires services of at least 10% FTE or 10% of full-time faculty load to be SURS eligible. Neither the university nor employees will contribute to the federal Social Security system while contributing to SURS. SURS participants are required to pay into Medicare. If you have previously participated in SURS or another state of Illinois retirement system, SURS will notify the university of the plan enrollment. There are 3 plan choices: traditional, portable, or retirement savings. SURS will mail a packet with plan and enrollment information to the mailing address that's on file with the university. The deadline to enroll is 6 months from the deadline date listed on the letter included in your packet. The traditional plan is the default if no election is made. An election or default is a one-time lifetime irrevocable enrollment. Most employees will contribute 8% of gross pay. If you are with our police department or fire department, you'll contribute 9.5%. Tier 1 employees are participants who first began their SURS participation prior to January 1, 2011. This applies to reciprocal systems as well. If you started your participation either with SURS or another eligible system on or after January 1, 2011, you'll be considered a Tier 2 employee. SURS offers a Tier 2 webinar. It's on the last Tuesday of each month, from 9:30 a.m. to 11 a.m. Registration is required. You can register at the SURS seminar/webinar registration link found on the Benefits Overview Resources page. There is also a SURS Plan Choice video series on the Resources page that explains the 3 plans in more detail. In this section, we will discuss eligibility and default enrollment. State of Illinois benefits are administered by the Department of Central Management Services or CMS. You will enroll online at mybenefits.illinois.gov. You can also call them by phone to enroll or ask questions at 844-251-1777 or TDD, TTY 844-251-1778. To be eligible to receive State of Illinois Group health insurance, you must be eligible to participate in SURS and be a regular employee with an appointment of 50% time or more, a temporary employee with an appointment of 50% time or more for at least 9 months, or an employee hired for at least 4.5 months at 100% time. Faculty, academic professionals, and other academics with an appointment of 100% for 9 months or longer are eligible for insurance at the full-time rate. Civil service employees with an appointment of 100% for 12 months are also eligible. Employees who work 50 to 99% of a normal work week are still eligible for insurance at a part-time rate. Faculty with an appointment that is greater than or equal to 4.5 months, but less than 9 months, will be considered part-time. For a calculation of the cost of insurance benefits, contact UPB. For more information, see the CGIP Health Insurance webpage. Foreign national employees that are on a J-1 or F-1 visa are not eligible for insurance until substantial presence has been met. All foreign national employees should register for a tax status review session using the tax status review link found on the Benefits Overview Resources page. Please submit a ticket to UPB if you have questions. Employees newly eligible for benefits have 30 calendar days from their hire date or eligibility date to make state plan elections, including waiving or opting out of coverage. For foreign national employees, this date is based on when the form was signed during their tax status appointment and when substantial presence was met. Failure to elect plans within 30 calendar days will result in a default enrollment for both full and part-time employees. Default enrollment includes Quality Care Health Plan, QCHP, including EyeMed Vision, Quality Care Dental Plan, QCDP, free basic life insurance equal to 1 times annual salary. There is no option for dependent coverage. The default enrollment delays the processing of the enrollment, receiving your ID cards, and the collection of benefit premiums. If any dependent, such as a spouse, civil union, or domestic partner or child is eligible for state employee group insurance plans as a member, each must be insured individually. Therefore, anyone who is currently enrolled as a dependent of a state of Illinois employee, regardless of agency, will be removed from that plan and will be required to enroll in their own coverage. Dependents who are added to coverage must be enrolled in the same health and dental plan as the employee. A Social Security number, SSN, or proof that the dependent is not eligible for an SSN must be provided to My Benefits as soon as possible within the 30-day enrollment period. Please contact our office if you are transferring from another state of Illinois agency. Employees with a break in employment status of less than 10 days experience no break in insurance coverage and are not considered a new employee, nor are they eligible for initial enrollment options. In this section, we will cover dependent eligibility, benefits choice, qualifying life events, and COBRA. Dependents can include a spouse, civil union partner, children, married or unmarried, through age 25, disabled adult children age 26 and older, and children that received an organ transplant after June 30, 2000. In addition, veteran adult children through age 29 are also eligible if they reside in Illinois. Their premium is determined by tax status. Civil union partners and their children can be eligible dependents, For IRS dependents, health and dental premiums are pre-tax. For those that are non-IRS dependents, health and dental premiums are post-tax, and the employee will incur imputed income. For rates, see the Rates and Calculators webpage. Employees who are adding dependents are required to provide digital copies of the supporting documents within the initial 30 calendar days. If the documents are not provided, the dependents will not be added to the insurance coverage. Documentation for a spouse includes a religious certificate or state marriage license, or the first page of your most recent federal income tax form. You can redact all the income information on that first page. Documentation for children include their state birth certificate, or both sides of their hospital birth record. Documentation for a civil union partner is your civil union certificate. Documentation for a partner's children includes your civil union certificate and their state's birth certificate, or both sides of their hospital birth record. Documentation must be received within the 30 calendar days of eligibility or dependents will be unenrolled. The preferred method is to upload documentation directly to your My Benefits profile. The second option is to fax them to My Benefits. The third option, but we highly discourage, is mailing them in. Please note that mailing them delays the receipt of those documents. If you are going to fax or mail, please list the employee name and CMS-issued login ID on every page. Visit the Benefits Overview Resources page for more information on submitting documents. Some dependent types will require additional documentation. See the Documentation Requirements webpage for details. Please contact our office if you have any trouble with uploading these documents. We offer a benefit choice open enrollment period every year. It begins on May 1st and it typically ends on May 31st. If May 31st falls on a weekend or the holiday, it will be extended to the next business day. The plan year is based on the state's fiscal year of July 1st through June 30th. Some of the eligible changes you can make are: add or drop dependent coverage. Keep in mind that documentation is required to add dependents. Change health carrier. Opt-in/opt-out of health, dental and vision. Decrease, terminate or increase optional life insurance. Increases require a statement of health. Enroll or re-enroll in flexible spending accounts such as Medical Care Assistance Plan, MCAP, Dependent Care Assistance Plan, DCAP, or the Health Savings Account, HSA. To continue participating in the MCAP, DCAP, and HSA, you must re-enroll each year. Qualifying life events allow for changes outside the open enrollment period. You have 60 calendar days from the day of the event to make the change. The effective date is typically the date of the request or the event date, if elected prior to the event. Some examples are employee or spouse changes in employment status, marriage, civil union partnership, or birth/adoption. The effective date of birth/adoption, divorce, or death will be the date of the event, as long as those events are reported within the 60 calendar days of the event. Documentation of the relationship is required, or the transaction will be invalidated. Some events may require additional documentation, such as dependent loss or gain of employment or health insurance. Coordination of spouses' open enrollment period and divorce. If you are processing a divorce event, we only need the first page and the pages with the circuit court stamp and judge's signature. As soon as a divorce event has been processed, the ex-spouse and their children are not eligible dependents, and their coverage will be backdated to the date of the divorce. Health plans cannot be changed during a qualifying event unless you are moving. All health plans are made available based on the county in which you work or reside. If you are moving from one county to another, and the health plan that you have had previously is not available in your new area, you can then choose a new health plan. After separation from the university, coverage will end at 11:59 p.m. on the last day actively worked. For example, if your last day actively worked is December 31st, your employee and dependent state health insurance and other state and university benefit plans will continue through 11:59 p.m. on December 31st. Beginning January 1st, you will no longer have State of Illinois group insurance. Insured members and dependents who lose coverage due to certain qualifying events may be able to continue coverage through COBRA provisions. UPB notifies CMS of your separation, and they handle everything with COBRA. CMS will mail you a letter letting you know your eligibility for COBRA. If you're eligible, the letter will include the amount of the premium, how to pay that amount, who to pay that amount to, and how to terminate the coverage when it is no longer needed. If you are separating and moving away from the university, Please update us with your address as soon as possible, preferably prior to the separation or move. Employees who opt out or waive state health insurance are not eligible for COBRA. See the State of Illinois Benefits Handbook online at the CMS website on the Benefit Program Books webpage. In this section, we will discuss health plans. Members can elect a plan from the county where they work or reside. Please find your county and review the coverage options available to you on the map that is available in the Benefit Choice booklet on the CMS website. Members living outside of Illinois can elect coverage based on where they work or reside. Work county is generally reported as Champaign, Cook, or Sangamon. Plan options available in My Benefits may not work out of state, so it is important to verify that the plan you are considering has providers in your area and that the providers you want to utilize will accept the plan you are considering. To verify that the plan you want has coverage in your area, contact the insurance policy plan provider to confirm the coverage. Also be sure to contact your health providers and provide them with the plan information to confirm coverage. We offer 4 types of health plans. The first plan we'll cover is the default plan, the Quality Care Health Plan or QCHP. This one is structured most like a PPO. It provides the freedom to choose providers and facilities in-network and out-of-network. The medical services utilize the Aetna PPO nationwide network, with behavioral health services offered through ComSci. Pharmacy services are administered by CVS Caremark. International coverage may be available for eligible services. More information is available by visiting the Aetna State of Illinois website. There is mandatory pre-certification for services such as hospital admissions, including maternity, in- or outpatient surgery, some diagnostic testing, and extended care facility admissions. A penalty will be applied if services are not pre-certified. There is a salary-based plan year deductible and additional copayments and deductibles for certain services such as emergency room, hospital admission, and transplants. The plan deductibles for the Quality Care Plan can be found on the My Benefits website and the Benefit Choice booklet. The sections titled Hospital Services, Coinsurance Percentages, and Out-of-Pocket Maximums list the amounts of additional deductibles. After all deductibles have been met, the plan is an 85-15 split for in-network physicians and hospitals. Preventative care is covered at 100%. After the deductible has been met, the plan will pay 60% of allowable charges for out-of-network physicians and facilities. The allowable charge is the maximum amount the plan will pay an out-of-network provider for billed services. Next are the Managed Care Health Plans. This includes the Health Maintenance Organizations, or HMOs, from Health Alliance, Aetna, Blue Advantage, and HMO Illinois. It also includes the Open Access Plans, or OAPs, from HealthLink, Aetna, and Blue Cross Blue Shield, BCBS. Health Maintenance Organizations are commonly known as HMOs. The plans offered are Health Alliance HMO, Aetna HMO, Blue Advantage HMO, and HMO Illinois. The plan utilizes copayments for services by in-network contracted providers. Out-of-network covers emergency room only. The copayments for the HMO plans and the out-of-pocket maximums can be compared on the My Benefits website and found in the Benefit Choice booklet. HMOs require a 10-digit National Provider Identifier (NPI) for the primary care physician, with the exception of the Blue Cross Blue Shield plans, HMO Illinois and Blue Advantage HMO. These 2 plans require a 3-digit medical facility code in place of the NPI number. Your PCP can be changed at any time by contacting the plan administrator. Provider directories can be found at the Health Plan Providers Directory link on the Benefits Overview Resources page. Women may have an in-network women's health provider in addition to a PCP, and no referral is required. Preventative care, such as in-network wellness visits, vaccinations, and certain diagnostic tests, are provided at no additional cost. Members should contact the plan administrators for specific plan coverage on surgeries, procedures, and testing that is outside the standard. Next, we have the Open Access Plans, or OAPs. The plans offered are HealthLink OAP, Aetna OAP, and Blue Cross Blue Shield OAP. These are managed care health plans with 3 tiers of coverage. Tier 1 is structured like an HMO. Tier 2 is structured like a PPO. And Tier 3 is for out-of-network coverage that are not a part of Tier 1 or 2. It can offer some flexibility in selecting healthcare providers, but can involve higher out-of-pocket costs, a higher deductible, and higher coinsurance amounts. Please note that telemedicine is not covered by Tier 2 and 3. In addition, certain services, such as preventative and wellness care, are not available under Tier 3. The plan pays 60% of allowable charges after the plan deductible has been met. The copayments and deductibles for the OAP plans and the out-of-pocket maximums can be compared on the My Benefits website and found in the Benefit Choice booklet. The tier in which the medical provider is contracted determines out-of-pocket expenses. Employees and covered dependents can use services from all three tiers at any given time based on their individual locations. Pre-certification is required for some services, or a penalty may apply. Provider directories are available on the Benefits Overview Resources page. The fourth plan type is the Consumer-Driven Health Plan, or CDHP. This is a high-deductible health plan as defined by the IRS. The deductible is $1,600 for individuals and $3,200 for families. It offers flexibility to choose providers and facilities in-network and out-of-network. Medical services are with Aetna PPO nationwide network. Behavioral services are through ComSci. Pharmacy services are through CVS Caremark. For in-network physicians and hospitals, the plan pays 90%. Members are responsible for 10% after the deductible. Preventative care is covered 100%. Out-of-network is 65% of allowable charges after the deductible has been met. More information on the copayments and deductibles for the CDHP plan and the out-of-pocket maximums can be found at the My Benefits website and the Benefit Choice booklet. The CDHP has a health savings account that goes with. The HSA offers pre-tax or tax-deductible contributions, tax-free interest or investment earnings, and tax-free distributions when used for qualifying medical expenses. You may not participate in the MCAP Flex Spending account, which we'll talk about later. You must re-enroll each year to continue contributing. In order to participate, you must be covered under a high-deductible health plan and have no other health insurance unless permitted by the IRS. You may not be enrolled in Medicare, including Part A, and you cannot be claimed on someone else's tax return. If you are enrolled in CDHP, you can elect for the state to contribute to the plan, up to 1/3 of the CDHP deductible, as well as making an employee contribution. Unlike an FSA, there is no use it or lose it rule with HSAs. Unused contributions remain in an interest-bearing account as a tax-free savings to be used for qualified medical expenses now or in the future. Please review the chart in the Health Savings Accounts (HSA) for active state employees section of the Benefit Choice booklet to determine the employer contributions and employee contribution limits. For more information, visit mybenefits.illinois.gov and the Administrator Optum's website. You are encouraged to use in-network providers to receive the best health plan benefit. Using out-of-network providers will significantly increase your out-of-pocket medical costs. Out-of-network services are reimbursed at a much lower rate in QCHP, CDHP, and OAP plans, and they are not reimbursed in the HMO plans. If you are referred to or choose to see an out-of-network provider, you should contact your health plan prior to receiving services to ensure the services meet medical necessity criteria to receive authorization and to request a cost estimate. For out-of-network charges, please note the following. Maximum reimbursable charge, MRC, are the maximum amount the carrier will pay for an out-of-network provider for eligible billed services. Plan participants will be responsible for anything over the MRC. These amounts will not be applied toward the plan year deductible or the out-of-pocket maximum. Maximum allowable charge, MAC, is the amount that the carrier will pay the provider and consider the service paid in full. Rates are determined by Medicare and the locality. They are routinely updated. Here is an example of someone who went out of network for a surgery. The surgery was $19,000. The MRC maximum allowed for eligible billed services was $1,739. The health plan reimbursement of 60% of that amount is $1,043.40, which left the member responsible for almost $18,000 because they chose to go out of network. So please keep this in mind and get a cost estimate as well as any necessary pre-certifications or pre-authorizations when seeking treatment out of network. In this section, we will go over premium charts, part-time rates, and opting out of coverage. Monthly employee, monthly dependent, bi-weekly employee, and bi-weekly dependent premiums can be found in the Benefits Choice booklet. Part-time employees are required to pay a portion of the state's contribution, resulting in a much higher cost for insurance. You can waive health, dental, and vision coverage through My Benefits, and still have the option to elect employee, child, and spouse optional life insurance. If you need more information on calculating health and dental insurance costs, you can use the health and dental rates tables located in the Benefits Overview Resources page, or the system will calculate your cost for you in the My Benefits system when choosing plans. Here is an example of part-time work impacting insurance costs. There are several variables in this example. First, the employee is on a 50% job or appointment, which is the lowest appointment you can work and still be benefit eligible. They have the QCHP, which is the most expensive health plan option. They are in the lowest salary category of $30,200 or less. All these factors affect the final premium amount. The cost for an employee at 50% would be $660.82 for employee only, $1,379.34 for employee plus one, and $1,562.49 for employee plus two. In contrast, an employee at 100% would pay $144 for employee only, $441 for employee plus one, and $479 for employee plus two. This demonstrates that the cost for a part-time employee versus a full-time employee is significantly higher. Therefore, employees have the option to waive their coverage within the 30-day deadline. Full-time employees can opt out of health, dental, and vision. Proof of other coverage is not needed when completing a new hire event to opt out. Proof of other coverage is only required when processing a qualifying event to opt out for a gain of other coverage. It must include the effective date of the coverage. An insurance card is typically not valid proof of your other coverage. You need to get a letter or a statement from the insurance carrier or the employer that states you were enrolled on a specific date. Opt-out elections must be made on the My Benefits website. Employees who are opted out of health, dental, and vision insurance can still elect employee, child, and spouse optional life insurance. In this section, we will go over prescription plans. CVS Caremark is the prescription drug benefit manager for QCHP, OAP, and CDHP. They have an extensive network of over 68,000 participating pharmacies, including all the major chains such as CVS, Walgreens, Walmart, and most of your major grocery store pharmacies. The network also includes roughly 26,000 independent pharmacies across the country. For non-maintenance medications, such as short-term pain medication or 5 to 10-day antibiotics, it is best to use an in-network pharmacy. When using in-network pharmacies, regular copays apply. For an out-of-network pharmacy, you would pay the full retail cost and file a claim form for reimbursement. Maintenance medications, things you take every day or on a regular schedule, you can get those at a maintenance pharmacy or through mail order for 2.5 copays. Use of mail order is strictly a personal preference. It's not required. At a non-maintenance pharmacy, the first 2 30-day fills will be at regular copay rates, then subsequent refills will be charged at double the copay rate unless you fill maintenance medications for 90 days. See the CVS Caremark prescription benefit webpage for more details. Members should log in and register on the CVS Caremark website. Registered members will have access to a list of network pharmacies, mail order claim forms, and much more. Members will also be able to utilize an interactive formulary list search tool, which will allow them to check their current prescribed drugs against the CVS Caremark formulary list. The QCHP prescription plan functions with an annual deductible of $175 per enrollee in copayments based on the medication tiers. Tier 1 has the lowest cost, Tier 2 is more expensive, and Tier 3 is the most expensive. Some preventative medications are no cost. And there is an additional savings if 90-day supply medications are filled at a CVS Caremark pharmacy or through their mail service. This is the Maintenance Choice discount. Copayment details can be found in the Benefit Choice Booklet Prescription Drug section of the plan. The OAP prescription plan has a $150 deductible annually and copays based on the medication. It also has 3 tiers. Some preventative medications are no cost. There is an additional savings if 90-day supply medications are filled at a CVS Caremark pharmacy or through their mail service. This is the Maintenance Choice discount. Copayment details can be found in the Benefit Choice booklet in the Prescription Drug section of the plan. The CDHP prescription plan allows some preventative medications at no cost or limited cost. There are additional savings if 90-day supply medications are filled at a CVS Caremark pharmacy or through their mail service, referred to as Maintenance Choice. The prescription costs are based on the annual health plan deductible rather than an additional prescription deductible. After the plan deductible is met, you are responsible for a percentage of the remaining costs. Copayment details can be found in the Benefit Choice Booklet Prescription Drug section of the plan. Each HMO plan uses an individual prescription benefit manager to administer their prescription benefits. Participants must use that health plan's network pharmacies, which are often the same major chains, grocery store pharmacies, and some independent pharmacies as well. You can contact each HMO for mail order options or personal reimbursement for out-of-network pharmacies. Copayment details can be found in the Benefit Choice Booklet Prescription Drug section of the plan. The HMO prescription has $150 annual deductible per enrollee. There are some preventative medications offered at no cost. The HMO prescription plan has the 3 standard tiers and an additional reduced Tier 1 discount. Copayment details can be found in the Benefit Choice Booklet Prescription Drug section of the plan. Prescription deductible and copayments count towards out-of-pocket maximum for all health insurance plans. Please note that preventative drugs have a $0 deductible in all plans. In addition to preventative drugs, the CDHP plan has preventative, IRS-allowed, drugs that are 90% covered, but the deductible still applies. In this section, we will cover the dental and vision plans. Dental coverage is optional, and you can either enroll or opt out. Our plan, the Quality Care Dental Plan, is through Delta Dental, Illinois. An election to opt out or into dental is only permitted during the initial enrollment or the annual benefit choice period. Employees and dependents can elect to have dental only. The plan year deductible for the Quality Care Dental Plan is $175. For preventative services, there is no out-of-pocket charge. Preventative services include 2 standard cleanings and a set of X-rays per plan year. If you have services outside of the preventative services, then the deductible applies. The in-network plan year maximum benefit is $2,500, and the out-of-network benefit is $2,000. There is a lifetime maximum benefit for orthodontia coverage. Treatment must be started prior to age 19. The reimbursement is determined by a length of treatment and whether it was done in-network or out-of-network. For more information, see the CMS Dental Plan webpage. There are 2 networks for the dentists, PPO and Premier. For a list of contracted providers, you can visit Delta Dental State of Illinois webpage. When a dentist participates in a network, they agree to accept an allowed amount as payment and cannot charge you the difference between their submitted amount and the allowed amount. The schedule of benefits can be found at the CMS Dental Plan webpage. If you use an out-of-network dentist, you may have to pay the entire bill upfront at the time of service and file your own claim, depending on the arrangement you make with the dentist. Claim payments for in-network and out-of-network dental providers are released according to the claim process date and available funding, as determined by the state of Illinois. Claims not paid timely will be paid interest in accordance with Illinois law. This is a hypothetical example, where all deductibles have already been met. The dentist's submitted amount is $1,000 for the PPO, Premier, and out-of-network dentists. The PPO allowed amount is $600. The schedule of benefits for PPO is $781. And your out-of-pocket cost for PPO is $0. For Premier, the allowed amount is $900. The schedule of benefits is $781. And your out-of-pocket cost is $119. For out-of-network, there is no negotiated amount, which is $0. meaning you will have to prepay. The schedule of benefits is $781, and your out-of-pocket cost is $219 after reimbursement. From this example, we should keep in mind that a PPO provider will provide the best discount. The Premier will offer a discount, but perhaps not quite as much, and the out-of-network providers are not required to offer any negotiated amount. The monthly dental premiums are taken each pay period. For our biweekly employees, this amount would divide it into year 2 payments. Part-time employees will pay a portion of the state's contribution in addition to the member contribution. Member-only cost is $15. Member plus 1 dependent is $25. Member plus 2 or more dependents is $27.50. A $2,500 benefit for hearing instruments and related services every 24 months is available through all health plans when a hearing care professional provider prescribes a hearing instrument. You will need to contact your individual health plan to get additional details. Delta Dental has partnered with Amplifone for hearing healthcare. You can get more information about their programs by calling 888-823-2130 or visiting the Amplifone Hearing Care website. In this section, we will go over the vision plan, EyeMed. Enrollment with EyeMed is automatic when enrolling in a health plan. We do not have an independent vision plan. In the Vision Care Plan section of the Benefits Choice booklet, you can find the copays for in-network or allowances for out-of-network services and the frequency at which you can utilize a benefit. Out-of-network claims must be filed within 1 year from the service date. A member must pay all optional lens enhancement charges. Participants can use either the eyeglass lenses or the contact lenses benefit every 12 months. You cannot use both benefits in the same plan year. In-network providers may offer discounts for a second pair of eyewear. You may use an out-of-network provider and file an EyeMed reimbursement claim form within 1 year from date of service. You can get a list of in-network providers by visiting the EyeMed Vision Care website. In this section, we will cover state term life insurance and accidental death and dismemberment (AD&D) plans, administered by MetLife. Employees are automatically enrolled in a basic life policy equal to their annual salary, provided at no premium cost to the employee. The value of basic life insurance in excess of $50,000 will be taxed as imputed income in accordance with the IRS. It is subject to federal and state income tax SERS and Medicare withholding, if applicable. Imputed income will appear on your earnings statement as excess life. All benefit-eligible employees must complete a beneficiary election. You can do this online or by paper, and then return it to MetLife. The state offers optional life insurance. It's available in increments of your salary. Increments up to 8 times the annual salary is available. 1 through 4 times is guaranteed issue within the first 30 calendar days of benefit eligibility. 5 through 8 times require underwriting approval and the completion of a statement of health. Optional life elections are available during benefit choice enrollment or throughout the year as long as a $50,000 value is maintained. Underwriting approval may be required. This may be completed at the My Benefits website. We offer a spouse life policy. It's guarantee issue within the first 30 calendar days of benefit eligibility, or as a qualifying event when adding a spouse. It's a $10,000 policy for a spouse under age 60 or $5,000 for a spouse age 60 and over. Underwriting approval is required after the guaranteed issue period. We also offer a child life policy. It is guaranteed issue at any time the election is made. It's a $10,000 policy for each child. The state also offers accidental death and dismemberment or AD&D. It is employee coverage only. You can enroll or terminate at any time, and it coordinates with your employee's state term life insurance. You can waive the coverage altogether. You can choose basic coverage equal to your annual salary, or the combined amount of basic and optional life insurance. The combined amount will offer you coverage up to 5 times your annual salary, basic plus 4 times optional. Or it will combine with what you have in optional life insurance. So if your optional life is basic plus 2 times, then your AD&D is going to be 3 times your salary. The rates for state life insurance can be found on the CMS Life Insurance webpage in the plan summaries for active members, retirees, and survivors. The plan's documents include the rates for the member, their spouse, and their children. For example, member optional life rates are based on age and amount of coverage. Spouse life monthly rate is $5.70 for $10,000 coverage under age 60. Child life monthly rate is 60 cents for $10,000 coverage. The AD&D monthly rate per $1,000 coverage is 2 cents. In this section, we will review the University Accidental Death and Dismemberment Plans, the Hartford. The university also offers an AD&D policy. It's family or employee-only coverage. You can enroll at any time. They do offer some pre-trip travel assistance, emergency medical assistance and personal services, and identity theft protection. The coverage is administered by International Medical Group. You can get more information from the Travel Assistance and Identity Theft Support Services PDF link, found on the Benefits Overview Resources page. This policy is structured a little differently. Your salary is not considered, so you choose the principal sum that you want for the policy, and then pay the premium for either yourself or yourself and family. Information about the policy and its cost can be found on the System Human Resources AD&D webpage. We recommend for employees to consider a power of attorney document to allow a POA to act on your behalf regarding your personal, financial, and business matters. This could be helpful in the situation that you are left incapacitated. Having this on file allows us to share information regarding the university, CMS and SIRS as necessary. In this section, we will go over flexible spending accounts. Flex spending accounts are administered by Optum Financial. Their website is optumfinancial.com and their phone number is 888-469-3363 or TDD-TTY 800-526-0844. This is a program that provides the opportunity to pay certain medical care and dependent care expenses with pre-tax dollars. Contributions are deducted from your paycheck and deposited into your FSA account before taxes are withheld, so it lowers your taxable income. The enrollment deadline is 30 calendar days from a date of hire or benefits eligibility date, and the effective date is that date of hire or eligibility date. Employees are eligible to participate in the FSA if they are eligible for a health plan, even if they opted out of the health plan. Employees paid over a 9-month contract should notify our office when you're enrolling, so we can verify that your contributions are calculated correctly. This is a payroll deduction-only contribution. Mid-year changes require an election within 60 calendar days of a qualifying event. You must have eligible expenses to withdraw the funds, and you must re-enroll each annual benefit choice period. For more information, see the My Benefits website. Medical Care Assistance Plan reimburses out-of-pocket medical expenses for employee and eligible dependents. This covers copays, coinsurances, deductibles for health, dental, vision, and prescriptions, including the amounts over the allowable charge for health. It also covers over-the-counter medicines, medical care travel expenses. The annual maximum contribution is $3,200 per individual. The debit card is automatically issued at no cost. For MCAP claims, all eligible expenses must be incurred by June 30, 2025. Claims can be submitted during the run-out period, July 1 through September 30, 2025 for services received through June 30, 2025. FY25 MCAP remaining balances up to $640 will only be carried over to the next fiscal year. FY26. If the member re-enrolls. Participants who have a balance exceeding $640 after September 30 will forfeit any amount exceeding this limit. Failure to re-enroll will result in forfeiture of any remaining balance. The rollover provision applies only to MCAP and does not apply to DCAP accounts. The Dependent Care Assistance Plan, or DCAP, is our second FSA offering. It's a reimbursement for eligible daycare, nursery, preschool, after-school, summer day camp, and babysitter expenses for children through age 12. When a child turns 13 mid-plan year, you must complete a DCAP change form and stop the deduction because they're no longer eligible. The funds can be used for adult daycare for disabled spouse or legally dependent parents. You must have the provider's SSN or tax ID number to participate. Services are only eligible for reimbursement when provided during the plan year of July 1st through June 30th. Services provided after June 30th are not eligible for reimbursement. To be eligible for DCAP, the spouse must be gainfully employed, seeking employment, have income for the year, be a full-time student, or disabled and incapable of self-care. There are special rules that apply for divorced, separated, custodial, or non-custodial parents. Please contact Optum Financial to get more information. The annual contribution limit for DCAP is set by the IRS. This is a household limit. If both parents are employed and are offered a DCAP FSA that they choose to enroll in, then their contributions are combined to get the annual limit, and you cannot exceed the IRS limit. The monthly limit is modified for university employees who are paid over less than 12 months. Again, if you're on a 9-month contract, please contact our office when you are enrolling, so we can ensure that your contributions are correct. DCAP is an alternative to the dependent care tax credit. Please note that if an employee claims the dependent care tax credit, the credit will be reduced dollar for dollar by the amount the employee contributes to DCAP. You will need to discuss with a tax advisor what the best option is for you and your situation. The minimum amount for which an employee can enroll is $240 per year, or $20 per month. In this section, we will discuss optional retirement and benefits opportunities. The University and State of Illinois provide optional supplemental retirement plans. The 3 available plans are the University 403B, the State Deferred Compensation 457, and the CSRS Deferred Compensation 457. You can enroll at any time. The age-based annual contribution limits are set by the IRS each calendar year. The limits can be found on the Supplemental Retirement Plan comparison chart. You may contribute the annual maximum to both 403B and 457 plans. Each of the plans have a minimum contribution requirement to participate. The comparison chart will be helpful to answer your questions about each of these plans and can be found in the Benefits Overview Resources page. The vendors for the University 403B plan are Fidelity and TIAA. Flat dollar or percent contributions are taken from each paycheck. You can enroll online at the System HR website at the Enroll In, Change or Stop Your 403B Contributions webpage. Both investment vendors offer one-on-one phone and virtual counseling sessions, and you can get more information at the University 403B plan webpage. There are 2 Deferred Compensation 457 plans. The State Deferred Compensation Plan is administered by Empower. Contributions are taken from 24 biweekly checks or 12 monthly checks. The CSRS Deferred Compensation 457 plan is administered by Voya, and contributions are taken from every payroll. You can enroll in either or both of these 457 plans, but keep in mind the annual limit will be a combined total of these 2 plans. There are multiple vendor investment choice. You can select pre-tax or Roth after tax. Contributions can be a flat dollar amount or percentage. Enrollment and changes to the contribution and beneficiary designations can be made at the Empower website or CSRS Deferred Compensation Plan webpage. Empower can be called at 833-969-4532, and CSRS Deferred Compensation can be reached at 800-631-9543. Please reference this Supplemental Retirement Plan comparison chart for details. Some important notes about the CSRS Deferred Compensation 457 plan, or CSRS DCP, are: it is only available to CSRS participants, so you have to be eligible for CSRS to participate in this plan. The CSRS DCP is a voluntary supplemental plan and can be selected in addition to your mandatory CSRS retirement plan. Any employee newly certified with CSRS on or after July 1, 2023 will be auto-enrolled in the CSRS DCP 457. Any employee newly certified with CSRS on or after July 1, 2023 may or may not be eligible to participate in the State Deferred Compensation 457 plan. Employees that are auto-enrolled in the CSRS DCP have 30 days from the day after CSRS provides Voya with the certification information to opt out of the plan before any contributions are taken. They have an additional 90 days to withdraw and receive a refund. After that, employees can elect to stop participating. However, they cannot receive a refund until they separate employment, turn age 59 and a half, or qualify for a financial hardship withdrawal. Deferral effective date. Initial voluntary deferrals, automatic enrollment deferrals, and elective deferral changes are effective the first payroll following the first of the month, or as soon as administratively possible. In this section, we'll discuss long-term disability insurance. For extensive information on disability plans, you can visit the Long-Term Disability Insurance webpage. SERS provides the primary disability benefits. The disability benefit may be claimed for an illness after 2 years of eligibility. There is no minimum service credit if the disability is due to an accident. There is a 60-day elimination period or exhaustion of sick leave, whichever is later. The benefit is 50% of base salary or 50% of average earnings for the prior 24 months, whichever is greater. Disability benefits end when total payments equal half of your SERS accumulative earnings. The university has partnered with Prudential to provide a supplemental LTD plan. You are eligible if you participate in SERS and are eligible to receive state health benefits. Offered through UI New Hire, it is guaranteed issue if application is received within the first 60 days of benefits eligibility. A health statement or underwriting approval would be required after the initial 60-day guarantee issue period. The coverage is effective the first day of the month after the election is made if enrolling within 60 days of benefits eligibility. There's a pre-existing condition limitation for the first 2 years of coverage. Supplemental LTD premium rates can be found on the LTD premium calculation webpage. By using the calculator, you can determine what your premium will be. Electing online will also calculate the premiums for you. Prudential coordinates with SERS, so a total benefit of 66.67% of base pre-disability earnings is paid up to a maximum of $12,000 per month. The Prudential plan pays 66 2/3 in the first 2 years, when no SERS benefit is payable due to illness. Prudential benefits start after a 90-day elimination period or use of all sick leave, whichever is later. Prudential will pay 66 2/3 in the first 2 years, and then when SERS starts paying, Prudential will drop to 16.67%, while SERS picks up 50%. Once you reach your SERS maximum, Prudential will go back to 66.67% for as long as you are on disability. Visit the Long-Term Disability Insurance webpage for details. In this section, we will go over some additional employee benefits. Commuter benefits allow employees to set money aside on a pre-tax basis to use for qualified mass transit expenses. The benefit can be utilized by active employees of any U of I system location who have a regular need to use Chicago area public transportation for work-related purposes, such as trains, buses, and van pools. You cannot use this account to pay for taxis, tolls, carpools, biking expenses, or parking. You can enroll, make changes, or stop your elections at any time. Funds roll over from month to month and year to year, and unused funds cannot be cashed out. Any unused funds left in your account when you separate employment will be forfeited. The maximum IRS limit for 2024 is $315 per month. For more information, visit the System HR Commuter Benefit webpage. The Shared Benefits Pool has been established to provide eligible employees who have exhausted all accumulated sick leave and, if applicable, vacation leave, the opportunity to receive additional leave days when a disability claim is pending before SERS or when experiencing a catastrophic injury or illness. Employees must donate to the pool to receive leave from the pool, and to be able to donate, an employee must have accumulated at least 11 days. See the Share Benefits webpage for more information. Tuition and service fee waivers are available for academic professionals with an appointment of 25% or more, civil service with an appointment of 50% or more, and retirees. Children of current employees with 7 years of service are eligible to receive a 50% tuition waiver for up to 4 years at an Illinois public university. Spouses are not eligible for tuition waivers. You can visit Human Resources or contact your university Human Resource Office for more information. They are responsible for the eligibility and policies of tuition waivers. University Payroll and Benefits handles the taxation related to tuition waivers. Employees who take graduate-level courses and are eligible to receive a tuition waiver should note the following. The first $5,250 of the tuition waiver is exempt from taxable income per IRS Code Section 127. When the value exceeds $5,250, the university will notify the employee of the taxability through email and U.S. Postal Service to the mailing address on file with the university, and we will withhold a required tax from U of I paychecks. If you have questions about the taxability of waivers, you can contact our office. If you have questions about the eligibility of a waiver, please contact HR. The University of Illinois provides the following time off and leaves. There is a regular holiday schedule and floating holidays. All employees are issued at least 2 floating holidays to be used during the fiscal year. They will be issued on July 1st, and they will expire on June 30th if they are unused. For vacation and sick leave accruals, please contact your unit or university HR. Some additional leaves include family and medical, parental, bereavement, disability, summer academic break or layoff, jury duty, military, educational, and personal. Certain leaves, such as educational, disability, FML, can be either paid or unpaid. Personal leaves are always unpaid. If you are going to be taking a leave of absence, please work with HR and your unit to determine exactly what kind of leave it's going to be, when it's going to start, and, if possible, when it's going to end. Once you have all those details in place, please contact UPB as soon as possible prior to starting your leave, so that we can determine how your benefit premiums will be paid while you are on leave. Several discounts and other services are provided by the University of Illinois. Travel discounts through preferred vendors for transportation and lodging can potentially provide you with a discount on your hotel room or car rental. Relocation assistance with moving companies and discounts on computer hardware, software, and computer accessories are also available. Ford and General Motors offer vehicle discounts if you're purchasing a brand new car. All the major cell phone carriers offer plan discounts to State of Illinois employees. Contact the desired carrier for details. In this section, we will go over other state benefits. The My Benefits Plus program is administered by CoreStream. Optional benefits that can be selected at Benefits Choice include accident insurance, critical illness insurance, hospital indemnity insurance, and legal services. Those that can be enrolled in year-round include group auto and home insurance, identity theft insurance, pet insurance, purchasing power, salary finance, and student loan refinancing. These optional benefits are available to full-time, state benefit eligible employees. You can get more information by visiting the My Benefits website or the CoreStream website, or by calling CoreStream Customer Care at 855-548-8800. CMS offers other wellness and benefit programs, including weight loss benefit, disease management programs, adoption benefit program, smoking cessation program, employee assistance program, EAP, and behavioral health services. If you have any questions about any of these programs, please visit the Other Benefits Program webpage or contact CMS directly at 800-442-1300 or TDD-TTY 800-526-0844. In this section, we will go over payroll information. Everyone should have completed UI New Hire. Part of UI New Hire is to enter your direct deposit information, entered online only. Give your consent to access year-end tax forms online, W-2, 1095-C, and 1042-S consent form, and complete your W-4 withholding forms. Non-resident aliens, for tax purposes, must complete a tax status review with Foreign National Service Center to determine tax residency status. After completing UI New Hire, you can make changes to your direct deposit, W-2 and W-4 forms, and view HR news and information regarding benefits, payroll, pay, leaves, policies, etc. on the System Human Resource Services website. On the My UI Info or Pay tab, you can access information about direct deposit, updates and changes, earnings statement, W-2, wage and tax statement, W-4, withholding allowance, certificate of working outside the state of Illinois, or ILW-5NR, if applicable, and employment verification. On the Business and Finance website, you can get information about payroll and earnings and payroll schedules. In this section, we will go over enrollment information. These are the 5 critical steps to completing your enrollment. 1. Retrieve UI new hire login information. 2. Enter bio/demo data on the My Profile form. 3. Log into My Benefits. 4. Make your state benefits plan selections. And 5. Upload any required documentation. For detailed instructions, view the Job Aid CMS My Benefits enrollment steps on the Benefits Overview Resources page. Now, we will go over the basics of enrollment. CMS requires a physical street address. If you are required to get your mail at a P.O. Box, please contact our office. Failure to provide a physical address on your bio demo form will delay your ability to register your My Benefits profile. If your mailing address changes, please make sure that you have updated the university and that CMS My Benefits reflects the new address to avoid issues receiving your ID cards. It's important to review and submit your demographic information and complete UI New Hire Step 1 as soon as possible. In 24 to 72 hours after completing and submitting your demographic information, you should be able to register with the My Benefits website. You may also receive login details through the mail from My Benefits. However, do not wait for this letter to arrive. It can potentially take up to 5 to 10 business days, which will delay you in accessing My Benefits. When logging into My Benefits for the first time, visit mybenefits.illinois.gov. For a step-by-step guide on how to log and see the My Benefits Login Job Aid in the Benefits Overview Resources page. Please note, try to complete your full enrollment in one sitting. Do not submit your elections until you confirm that they are correct. Benefit elections are final and unchangeable until either the next benefit choice period in May or a qualifying event occurs. If you make an error, please contact our office or the My Benefits call center as soon as possible. We will do what we can to assist you. You must submit required documents in the same 30 calendar days of your new hire date or benefit eligibility date for the transaction to be approved or to have dependents added to your plan. You have the option to print your benefits confirmation statement after you've submitted your elections. You will receive a benefits confirmation statement in the mail to the mailing address that's on file with the university. Please review for accuracy. Verify your names, dates of birth, and enrollment options for you and your dependents. If you find an error on the form, please reach out to My Benefits as soon as possible. ID cards will be mailed by the insurance companies directly to you 2 to 4 weeks after you receive your benefits confirmation statement. If you have questions or concerns or having trouble with your accessing your My Benefits account, please reach out to them at 844-251-1777 or TDD-TTY 844-251-1778. Their hours are Monday through Friday, 8 a.m. to 6 p.m. Central Time. You can also submit a ticket to UPB Service Portal by visiting the University Payroll and Benefits Service Portal. Registering for attending an orientation or submission of benefit elections is not a guarantee of benefits. Benefit eligibility can only be determined by reviewing the employee classification, job, and in the case of some foreign national employees, their tax status. For information about eligibility criteria, contact your university UPB office. Please note that benefit deduction errors in your paychecks can be corrected for a limited length of time. When you first start with the university, you may see that no benefit premiums are deducted out of your payroll. It may take a cycle or two of payroll to get your premium amounts finalized. This is based on when you do your enrollment and when it is processed. So at first, your paychecks may not have premiums collected, but you will still owe those premiums. Any past due premiums will be collected on future payrolls. You will be notified via email about benefit adjustments in advance. If you have passed 2 to 4 payrolls and made no changes to elections, but payrolls are still not consistent, please reach out to our office. This is the end of our presentation. If you have any questions, please contact UPB. Remember that the websites and links referred to in this presentation can be found in the Benefits Overview Resources page. Thank you for watching.